Hi everyone, Megan here at Orthopedic Specialist, and I am here today with Dr. Nitin Khanna, our orthopedic spine surgeon who specializes in minimally invasive spine surgery. And we're here today to do a quick Q&A on some commonly asked questions that Dr. Khanna has heard from his patients. His nurse, Denise, of 15 years, has actually compiled a list for us, and we'd like to give you a little insight and have a fun little light Q&A to go over some of these things. So the first question, Dr. Khanna, is how does a patient know when it's time to see a spine surgeon?
I think this is a great question. Most patients that come in are terrified to see a spine surgeon. They're fearful of surgery and what that may entail. I'm very big on determining the diagnosis, as I think that the diagnosis is key to treatment. Most of the time, it's a very simple fix once the diagnosis is made. So I would say any patient that's had pain going on more than 1 or 2 days, severe shooting pain in the back or legs, neck or arms, any evidence of weakness, difficulty with bowel or bladder control, those are the obvious signs. If you're unable to sleep and you're really having a tough time getting through the day due to back, neck, or again, radiating pain or weakness, again, those are times when one really should seek help. In the old days, everybody would run off to the emergency room and try to go through their primary care. At Orthopedic Specialists now, we have many locations across the region, and coming in for an evaluation, I think, is basically easier than it's ever been.
Very good, thank you. So another question is, why would a back issue cause weakness?
So a back issue or a neck issue may lead to compression of a nerve. When a nerve is pinched, 3 different things can happen. One is one can simply have pain. One is a sensory deficit, which is numbness, tingling in the arms or legs. And the third thing that can happen when a nerve is pinched is weakness, what we call motor weakness. And so those are situations, again, which we tend to be a little bit more aggressive about from a surgical standpoint. The key to understanding weakness, though, is to be able to make a distinction between weakness that's secondary to pain and weakness that's truly secondary to the nerve being pinched. Sometimes people are in so much pain that they may seem weak, but in actuality, when you're able to treat that pain, that weakness resolves, and again, you're able to avoid any type of a surgical intervention.
Okay, interesting. What diagnosis would cause it to be difficult for a patient with back issues to walk?
So again, pinching of the nerves tends to be the primary reason why people have difficulty walking. Shooting pain down the legs, weakness. Up higher in the spinal cord, in the cervical spine, which is the neck, or the thoracic spine, which is around your rib cage, if the spinal cord itself is pinched, that can again lead to this weakness or wobbly sensation in a patient's legs, which can make it very difficult for them to walk. Other issues such as lumbar spinal stenosis or pinching of the nerve roots in the lower back can lead to something called neurogenic claudication. When the patient tries to walk, their legs hurt a lot, and the only way they can get any relief is to sit down. Again, there are multiple ways to treat that non-surgically, and now with some of the more advanced minimally invasive procedures, we're able to treat patients within 45 minutes to 1 hour procedures and get them up and walking and pain-free, relatively quickly.
Wow, a lot of advances in technology and medicine. That's amazing. What should a person do if their back pain interferes with their sleep at night? I know you've heard this question asked over and over.
That was one of the questions that we get a lot, and again, I would seek help. And I think it's great if you have access to a primary care physician, but again, at Orthopedic Specialists, we have 7 locations throughout the region, and it really shouldn't be very difficult to get in and see someone. The key to really unraveling the mystery here of the spine is to really come in and get an early diagnosis and be evaluated.
Okay. What can people do, should you be on bed rest with back pain?
Again, in the old days, that's something that was recommended. Nowadays, we're very cognizant of this term deconditioning. And what we've realized is if a patient lays down, even if it's for as short a period as 24 hours, that they really can get deconditioned and all the muscles will get very weak. So we have actually gone the other direction, which is early mobilization. Some of the minimally invasive spine surgeries that we do, we want those patients up and walking within hours of the procedure. One of the lumbar fusion procedures that I've designed and developed called MASPLIF, the average length of stay was 2.5 hours after surgery with the patients walking out of the hospital, just like you see on television.
Excellent. Okay. Should you use ice or heat for back pain?
This is, again, a very common question that we get. I don't think that there's a specific answer. I think for an acute injury with an acute bruise, I think ice tends to be the best to quiet down the inflammation. I think when you have an area of the body that's very tight and the muscle needs to be loosened up, I think heat tends to be the best. But basically, whichever one makes you feel better. We're really after results here. I don't think there's any strong science one way or the other.
Sure. Okay. Excellent. We're winding down here. So, what are some exercises that you might suggest people do for your back?
So, as I've gotten older, I'm in my 16th year here at Orthopedic Specialist, I've instituted some of these exercises myself, which are basically focusing on being limber, maintaining joint motion, keeping your core muscle strong, basic things such as going for walks. In 2018, sitting is considered the new smoking. So one of these follow-up videos, we're gonna do something called a micro workout. So when you're at work, some of the exercises that one can do when they're at work can maintain motion, maintain the strength of your core muscles, your neck muscles, your shoulder muscles. As more of us are on our phones and computers, a lot of these will tend to fatigue, and situations such as text neck and so on and so forth are more prevalent than ever. I suggest patients take on yoga, Pilates, simple stretching, something in the order of 10 or 15 minutes in the morning and 10 or 15 minutes in the evening, which is actually sustainable, is very key to long-term success and health of the spine.
Okay, fantastic. So that will wrap up our interview Q&A for the day, and we have some exciting news. We are going to be raffling off to kind of coincide with Dr. Khanna's recommendation on promoting movement and health, spine health. We've decided to raffle off this yoga mat here along with this Under Armour water bottle. So for those of you who like and share this video, you will be entered in our random drawing, which will take place next Wednesday, and you'll have the opportunity to win this portable yoga mat along with our water bottle. So thank you so much for watching. We appreciate it, and Dr. Khanna, thank you as well. Have a great Wednesday.